We are representing one of the leading consultant laparoscopic surgeon. He specializes in obesity and bariatric surgery. So he would speak about the obesity and diabetes related disorders and how to cope up with these problems. So, Dr. Ashish.
Diabetes has come up in a big way, especially in the Asian countries. Using affluent lifestyles, everybody is having, most of us is getting this abdominal obesity. The fat which is accumulating in the abdomen is the leading cause of the type 2 diabetes. Type 2 diabetes is something which is treatable, which is curable. Common causes for obesity and diabetes is, again, it's a mixed spectrum. Genetics, many of us who are having type 1 diabetes are genetically having this some genes which are because of which they are deficient in the insulin. And what are the acquired causes? Many of them have some of the genetic level changes which are also making them prone to the type 2 diabetes also after attaining a certain age. But type 1 diabetes comes at very early age. Second are behavioral, like what type of exercises, what is our lifestyle, and how everything is we are doing. It also affects. Third is environmental factors. What are our eating habits? Right. First cause in type 2 diabetes is obesity. Second is stress. So in type 1 diabetes, basically good control of sugar which is required. But in type 2 diabetes, if we can prevent the weight, we are preventing ourselves from the coronary heart diseases. If somebody who is very obese is always at a risk of, especially in females, breast cancer has increased. Another problem is sleep apnea. If somebody is very obese, what happens is in their laryngeal tissue, in the pharynx, there is deposition of the fats and ultimately they start snoring. With the snoring, what happens is, suddenly they stop breathing in the night in between and there are pauses in the breathing. At that time, oxygen is not reaching to the brains. So in the morning, all these people who have sleep apnea, they feel very drowsy.